Hello, this is Gary Franke. Today I want to give you an overview of the 2025 open enrollment for individual health insurance in Washington State from November 1st to December 15th. You must select a plan by December 15th for January 1st coverage. There are no exceptions. We are open Sunday, December 15th as well. I will be here all day long. Heffernan Insurance Brokers is now the parent company of Achieve Alpha Insurance. So we are all part of a larger family now. Myself, Gary Franke, Tamara, Chander, and Brianna, Crawford, we all do individual health insurance. Melissa Tibbs and Tamara Chandler do more Medicare. If you have any questions, call or text message us at 425-802-2783. These are just overview of plans, so just take those with a grain of salt. Look everything up on the individual health insurance carrier sites. This is the Washington Health Plan Finder where you do enroll. You do not enroll through healthcare.gov since we're a state-based exchange. The main important thing is when you enroll on your own, or you can call us and we can do it for you, hint, hint, report a change button is how you update things from the year to year. Whether it's your address change or your income change or updating, different information, that is where you update that. The message center has every message ever sent to you in that upper right-hand corner. I don't know why they put it over there. It's just random, but it's hanging out over there. To find a broker, to add us as a broker, there's no additional cost, just like auto insurance. So it's free for you to help, for us to help you out from that perspective. By my last name, Franke, Franke, click search, request help, proceed, and we can help you out going forward. Anybody in the agency can help you there. The Smart Plan Finder is not very smart. You need to look up doctors in the individual insurance company's website because it's just not accurate on the health exchange. I don't know why. To search, you click on the filter button for the insurance carrier or the different type of plan you want. For example, Ambetter, Cascade, Silver. Ambetter is part of coordinated care. So if you are looking for the plan, you're clicking on that, you click on that little button there to search. For 2025, the average rate increase was 10.7%, which means, for example, Regence is going up by 22%. However, if you are getting tax credits, you're probably going to go up by maybe 12% or so. It's the difference between that in general. On average, you pay 9% of your income to the second cheapest Silver plan. So that's just kind of a barometer on how the pricing changes. But Regence and United Healthcare had the largest changes. We're going to kind of go through these. Feel free to stop this presentation anytime to go through it. I'm trying to go through pretty quick. The Cascade Silver plans are the same network for that carrier. So for example, with Regence, the Cascade Silver network is there. They do not have a Cascade Select Silver like Ambetter does. The Ambetter Cascade Select Silver is a very small network. Just generally try to stay away from those. Or with LifeWise, they do have a more narrow network, but make sure your doctor's in that network if you're in a county outside the three main King, Snohomish, and Pierce County. Income level for tax credits. From year to year, use the modified adjusted gross income, which is pretty much all your taxable income from your W-2 job, capital gains, dividends, interest, for 2025 year for 2025 health insurance. So just giving you an overview, we're not accountants. We can't give accounting advice, but we can help you figure out what your tax rate level is. It'll adjust at the end of the year, so there's no gaming the system. This is a quick overview of how prescription drugs are covered. Tier 1 are cheaper, Tier 2 and Tier 3, and as you hit Tier 4, those are a lot more expensive drugs. LifeSecure is an individual policy. We generally sell a lot of the accident insurance policies. For example, if you're accident prone, here's kind of sports by activity by age. If you're accident prone, get one of these policies. If you play a lot of sports, whether you're in high school or you're an adult playing sports, get one. It will pay out for new injuries and accidents. Here's an example of a real family. 2 years ago, the family of 4 was on a silver plan. The plan was going to go up to $1,400 a month. We put them on a bronze $1,000 a month plan and got him an accident plan for $92 a month. On January 2nd, his son hit his head, went to the emergency room, $3,000 bill. I believe it covered $2,600 of that. So they came out ahead by picking a bronze plan. It paid more than the $2,500 deductible. Compared to the bronze, they still had to pay it, but they got $2,600. So it pretty much paid for itself just in the second day of the year. This is the doctor network for the different carriers in general, and this is the hospital network. The hospital network essentially To the left-hand sides of the hospital systems, to the carriers. We'll go over that in a little bit more detail. Feel free to pause this presentation whenever you need to. The Cascade standard plans are the same for every single carrier. So Premera, Regence, Ambetter, United Healthcare all have the same Cascade Gold plan design structure, but the networks are all different. For example, if you have a $10,000 emergency room visit, the gold you pay about $1,000, silver's $3,300, or bronze is $7,500. Just kind of a quick overview. Anything down below in the green and gray section is covered before, like the $600 deductible, $2,500, or $6,000 deductible. The max out of pocket at the top is the maximum you'll pay per year. So if you have a $100,000 expense for the year, medically wise, you're only going to pay $9,200 as long as you stay in the insurance network or you have a true medical emergency. Ambetter is one of our most popular carriers just because they're lower cost. The advantage of Ambetter is their coverage in over 26 states for in-network coverage in those other states, reciprocity. So from that perspective, if you go to Arizona or Texas or Florida a lot, you can go to regular in-network doctors. They have a very large network of hospital systems, but they have a medium network of independent doctors. If you need to see a dermatologist or psychologist, Ambetter is probably not your plan. They're just a little bit weaker in that area, but the cost difference is significantly lower. So you can kind of look at the plans. The most popular plan for the year was the Bronze Plus with Ambetter that's exclusive to them. It's a zero deductible plan. It's very popular just because it's very cost effective for a lot of families that use a moderate amount. If you're going to have a baby or a bigger surgery, a lot of times the Cascade Gold plan for any of the carriers can work better. Regence has the best customer service in the industry, bar none. They're in Washington, Oregon, and northern Utah. They have a very large network of hospital systems. They do not cover Swedish and Providence, as in Ambetter doesn't cover UW and Valley Medical as much. But Regence has a very large network of independent doctors. So this is kind of an overview of how that system works. LifeWise is owned by Premera, but it's kind of the skinny network. It mainly covers Swedish and Providence for the most part, but it has a larger network of independent physicians. But it's significantly cheaper than Premera, and Premera is only in a couple counties as well. With Premera itself, it has a large network of hospital systems and a large network of independent doctors, but it is very expensive. The only people left on it pretty much are very sick or just, it's a very expensive plan. One key thing is this year, down below, you can see individual signature network. When you're looking at the Premera network or any of the other carriers, down below in blue, we'll say that the network of doctors for that carrier and the different plans available. Premera and LifeWise, you must pay for those from an individual checking or individual credit card. They can tell with you doing it through a business account. If you ever try to, it will not work. Kaiser Permanente has Kaiser-only facilities for regular doctors. There are some out-of-network services, but not quite as much. For the price, Kaiser's just getting so much more expensive. They're almost as expensive as Regence nowadays. But of the three plans individually from Kaiser, these are the best for the price. Molina Marketplace is more expensive than Ambetter, and the network is about the same. They don't cover Virginia Mason as well from that perspective. But they can work depending on your situation if you need Virginia Mason or if you need University of Washington or Valley Medical. That is the cheapest plan for that price. United Healthcare is going up about 22% this year. They're a little bit cheaper than Regence this year, but not much. They do have a little bit better network just because they cover Polyclinic, whereas Regence does not. Premera also covers Polyclinic, but United Healthcare can be an effective option. They do have a pretty good network of independent doctors, but it's like one step below Premera and Regence in LifeWise for the most part. But it's pretty much on par from that perspective. Health savings accounts are regular health insurance plans. Regence is bringing back their health savings account, whereas LifeWise is getting rid of it. So if you definitely want an HSA plan, Regence, Premera, and United Healthcare are the three main ones that are available in the year. We are not accountants, and we can't answer your tax questions, but this is the overview of what we've seen for the contribution limits that you can put into those plans. Here's an example of the Vision Services plan. It's about $17 a month or $34 for a family. Get the plan if you're going to use glasses more. It covers 20% beyond the savings allowance amount. Very effective for the price. Last year, Companion Life came on the market on the Health Plan Finder only. It's not a great plan. It's a super narrow network, and people had a lot of hard time using it. Pick a Delta dental plan if you're going to get one on the health exchange, or you can do some direct plans. Emeritus is one of my favorite direct dental plans. Are about half the cost in general of Delta Dental. They probably only cover 75% dentists in Washington State or across the nation, essentially, but they're very affordable. So, for example, it's about $36 a month for one person, whereas Delta Dental will probably be twice that. But these are very effective plans. We can help you go through that. Here's kind of a quick example of what it does cover, up to $2,000 per year. After 6 months, the initial 6 months, it covers crowns and root canals. So if you need those services, we can help go through that. Delta Dental has a lot of dental plans going direct to them. The Optimum and Premium plans are pretty much the only ones I really sell. The other ones can work, but for the cost, they're very effective. They work really well. They have a brand new $5,000 Optimum plan. So if you do want that, you can call Delta Dental or call us and we can help you go through that process. Here's the pricing. The east-west divide is pretty much the Cascade. So if you're on the west side, you're paying this amount on your east side, or further to the east, that is your price. Here's the Delta Dental Direct and VSP plan. So if you're getting a direct Delta Dental plan, you can also get a VSP plan, which you tack on, which is a few dollars cheaper than getting it direct to the VSP plan. So it is a good plan for the price. If you're going to do it, just do it if you're getting a direct Delta Dental. This is the Washington State Delta Dental plan on exchange. For adults, it's a pretty weak plan. It covers up to $1,000 and does not cover crowns and root canals. But if you're just getting cleanings and fillings and need an extra periodontal cleaning, it is a very effective plan. Just want to show you the limitations. The Washington State Exchange plan for Delta Dental children under the age of 18 is a really good plan for the price, but it's $50. So if your kid needs a lot more dental, that is a very effective plan. It doesn't cover braces, so that is not covered. Cost share plans they're not as effective anymore. The costs have come up so much. If you do want one, they can work in situations, but in general, they're not the most effective anymore. So in conclusion, if you have any questions, give us a call or text message us at 425-802-2783.